Welcome to the Breast Imaging Center. Your doctor has found an abnormality on your breast imaging today that requires a biopsy. A biopsy is a procedure that uses a needle to take a tiny amount of tissue from the abnormality in your breast to send to the pathology lab. The pathology lab examines the tissue under a microscope in order to determine if the abnormality is cancer. Most breast biopsies are benign or not cancer. However, it is important to determine the diagnosis in order to start any treatment that might be necessary. The earlier cancer is found, the better it can be treated. The most common symptoms patients can have after a breast biopsy are bruising and soreness. If you experience these symptoms, you can use an ice pack as needed for pain relief, or take whichever medication you would normally use for a headache, such as Tylenol. We will provide an ice pack and some Tylenol in your care package to take home with you. While the risks of the procedure are low, any time that a needle is used with a patient, there is a risk of bleeding and infection. We will do everything we can to reduce these risks for you. Things to watch out for after your procedure include redness, swelling, more pain than expected, or unusual symptoms. Our phone number will be given to you for any questions or concerns after your biopsy, or if you have any serious concerns, such as severe pain or uncontrolled bleeding, we ask that you go to the nearest emergency department to be evaluated. Also, while we do everything we can to ensure that enough sample is taken to send to the lab, occasionally the lab results will come back inconclusive, and an additional biopsy will need to be performed, or you will be referred to a breast surgeon for further evaluation. The alternative to having a minimally invasive breast biopsy performed would be to have a surgical biopsy. Surgical biopsy is a longer procedure that has more risk involved and a longer recovery time. The other alternative would be not having a biopsy performed. However, given your particular breast finding, your doctor feels it is necessary to perform a biopsy to rule out cancer, so that treatment may be started as soon as possible if needed. A breast biopsy takes about 15 to 45 minutes start to finish, depending on how many samples need to be taken. Your biopsy will be performed by a radiologist using either ultrasound, mammography, or MRI, depending on how your breast lesion is best seen and can most safely be reached. Numbing medicine will be used to numb your skin. You will not need to be put to sleep for this procedure. Using imaging guidance, the doctor will guide a needle to the breast lesion and take tiny samples. Next, your doctor will place a tiny marker in the area that the biopsy was taken. The marker is approximately the size of a sesame seed. The marker is made of titanium and you will not know that it is there. The marker shows up on your mammogram indicating the area that was biopsied, which will be important for the radiologist to see on your future mammograms. This marker may also be very important should the area biopsy require additional treatment such as surgery. The marker is safe to have in your breast and will not cause any trouble with airport security or other imaging studies such as MRI. At the end of your biopsy, your doctor will apply special sticky bandages called steri strips and a larger clear bandage over the area. No stitches are needed. A post-biopsy mammogram may be taken to ensure appropriate marker positioning. You are then free to drive yourself home. You will keep the outer bandage on for 24 hours and the steri strips on for 1 week. These usually fall off on their own. We ask that you try to take it easy for at least 1 day after your biopsy. Your results should be back from the lab in about 3 to 7 business days, and your radiologist will call you as soon as the results are in. At the end of this video, we will have you sign a consent form indicating that you understand the risks and benefits of your breast biopsy and that you agree with having a breast biopsy performed. If you'd like to speak with your radiologist before signing the consent form, just let us know. And please let us know if you have any questions during your visit. We look forward to taking care of you.